talk about it quite a bit, but very few women will actually admit it and become vulnerable about it. But we're talking about female incontinence, and it really is a much wider issue for women than we might realize. We have Dr. Angela DeRosa back, and this isn't just for women who've had kids.
No, this isn't. And actually, what's interesting is today, in today's age, we're talking more about 50 Shades of Grey than we actually talk about urinary incontinence. And it can happen at any age. Typically, the most common things that cause urinary incontinence, first off, you're right, childbearing, but also chronic constipation, those women who have a weak pelvic floor, or even just what we call urge incontinence, which can come from bladder spasms itself. So there's multiple causes for incontinence.
Okay, but you don't have to live with this forever.
No, absolutely not. And when you look at what, you have to look at the causes of the urinary incontinence, because as I mentioned, there are two types. One is called stress incontinence and one is caused by urge incontinence. And I brought a little bladder to demonstrate the differences. So if you were to think about urge incontinence, where you have to rush to get to the bathroom at the end, that's actually the bladder wall kind of spasming uncontrollably. That is a neurological problem being stimulated from the brain, and that's most often treated with medications. But the most common is the stress. So we say, I laughed so hard I peed my pants. That's the stress incontinence. So normally, if you were to imagine the bladder sits straight up, and you have the urethra that comes on the opening, the urethra opening, and you have a certain angle that prevents things from flowing out easily. But as you get older, or if you childbear or you get constipated, your bladder starts to drop.
Interesting.
Which then leads to a very even line for the bladder to now, if it spasms even a little from, say, laughing or coughing or sneezing or bearing down, you're going to leak urine very easily out of the urethra. So it's really a functional drop, and the way to fix that, if you don't want to have surgery, is there's some conservative things. First and foremost is by lifting the bladder. So there are things called pessaries, which can actually go in the vagina, sit there and lift them up.
And that's not surgical, that's just something that you...
That's non-surgical, but one of my favorite ways to help with that is called the Kegel Ball. Okay. Now, you may have heard about Kegel Balls, but they are really called Benoit balls in the past, in 50 Shades of Grey, which can actually be pleasurable for women. But also, one of the balls can be inserted, and these are weighted in different sizes. Okay. And what happens is it causes the vagina...
I was just wondering if it was heavy. Anyway.
It causes the vagina to contract with it. So if you think about Kegel exercises, you have to think about this. By inserting the ball in the vagina and leaving it there all day, it makes the vagina think about it all day long.
You wear this thing around all day?
Yes.
Interesting.
And what it's doing is it's causing the vagina to work out. So it's like building the vaginal muscle. So what it does is instead of, it lifts the bladder back up because you're now building the muscle that sits underneath
I'm just looking at the guys' faces around here. They're like, what are you doing with that thing?
What are you guys talking about?
Here, act fast.
If you want to get a set of balls, here you go.
What did you just say?
Oh, Dr. Rosie, you cracked me up.
So they come in 3 different sizes, 28, 38, and 48 grams. So.
All right. So, I mean, we're laughing about this, but, I mean, this is a very serious issue. Absolutely. And if we want to get our own set of balls, we just give you a call?
Exactly. And it's mainly for women, but if the guys want them too, I'm certainly happy to sell them to them.
All right. Thank you so much. And thank you for offering a solution when it comes to this, because women are not talking about it, and because you're talking about it, I think it gives us all permission to at least think about it.
And there are things other than medications, there are things other than surgery. The key is to come talk to us, and we can help you decide what type of incontinence you have and then how to best fix it.
Wonderful. All right. Thank you so much.